hospital in Florida who performed surgery on the wrong leg in 1995 because of miscommunication. There have been many other cases. I'm just picking a few. Now that led to the adoption of timeout verification protocols that before anyone went to do surgery, they started having these protocols that we are properly verifying things like this. I think you might have heard of more cases than I would related to these things. Legal consequences. There are so many. Here I've just covered one case. In 2019, California hospital faced a $10 million lawsuit after a patient died because of miscommunication about their deteriorating condition. Have you heard of these cases?
Yes, ma'am. Similar
Yeah,
cases we are.
first.
Yeah, exactly. So this happens quite a lot. I think not just this, there have been, so imagine one miscommunication and your hospital gets sued for millions of dollars. Like there are so many cases like that. And of course, loss of trust. In 2018, an Australian patient was left paralyzed after a surgeon failed to communicate procedure risks, and that damaged the hospital reputation. Then there could also be, I think you talked about it, Shami Mansi, that there could be patient harm. That's a very important one. In 2014, a nurse's mistake led to a patient's death in a Tennessee hospital. Error occurred because of miscommunication and lack of proper labeling of the medication. And this resulted in criminal charges. It means that they could have imprisoned the nurse who did this and a $30 million settlement, highlighting the need for better communication and medication safety practices. Laws have become very strict, and patient harm is a very, very important issue. So, these are all the reasons why we need to be careful, right? Now, also, there could be patient discharge errors. So, in 2016, a UK patient suffered a stroke after discharge. Why? Because of poor follow-up communication. So, the discharging team should have made it clear to that person that you have to come for a follow-up. Otherwise, something could go wrong. They need regular checkups. And suppose if the patient would have come for a checkup, they would have seen that something is wrong, and maybe a stroke could have been prevented. So, what happened? Hospital was found negligent, right? And of course, there were some consequences. That's highlighting the need for better discharge procedures.